Good day, my dear viewers. As always, my name is Rekia Hassanbako, a staff from Diabetic Herbal Medical Center. This is a center that gives medicines that are made from 100% organic herbs, which has gone through series of tests by the National Agency for Food and Drug Administration and Control, NAFDAC, to be used around the world. And NAFDAC has also given us the license, has approved and done every possible research on these medicines, and I'm proud to tell you that these medicines we are giving it with 100% guarantee for you to be cured. Also, our medicines are very effective and affordable, and it doesn't have side effect. Well, today I'm going to talk about a disease which is called mouth ulcer. I'm pretty sure some of you might not know what this mouth ulcer is. Some of you might tend to take it as, oh, it's just normal and all that. No, sometimes this ulcer is kind of like, let's say, it's just something that shows you that there might be an underlying problem. But first of all, what is this mouth ulcer? Mouth ulcer is a sore that appears anywhere inside your mouth. These sores are usually maybe red in color, they might be yellow or whitish in color, and you might have one or several sores in your mouth. The sores are often painful. Yes, the sores can be painful. That is, in let me use layman's English. Boil, you see it in your mouth. It can be painful sometimes and can make eating, drinking, and even speaking uncomfortable for you. Yes, so you can get mouth ulcer on, let me say, sorry, you can get mouth ulcer in your inner cheeks, around this place, inside. Also, in your inner lips, around this side. Also, you can see this sores on the roof of your mouth, that's upper side of your mouth. Also on your tongue, then you might see the sores there, or on your gums, that's this one on your teeth. Those are the places you can see this sores. Types of mouth ulcer. We have several types of mouth ulcer, but I'm going to list some of it, which are, we have the canker sores, we have the oral lichen planus, we have the leukoplakia, we have the erythroplakia, we also have the oral thrush. These are some of the types of mouth ulcer I can mention to you right now. So what are the causes? Sorry, what are the symptoms of this mouth ulcer? First of all, there might be loss of appetite, there might be swollen skin around the sore. Also, there might be inflammation around the edges. You might also be experiencing pain while swallowing or eating, because like I said earlier, it does not even allow you to eat, to speak, to drink water comfortably. Also, another symptoms of this mouth ulcer could be headache. You could be experiencing fatigue. You could also be experiencing night sweat and fever. There are different types of symptoms you might be experiencing. These are just few from it. And like I said, whenever you notice any of these symptoms, please come to Diabetic Herbal Medical Center. We have medicine that is 100% organic, and it doesn't have any side effect. Even though you are pregnant, yes, you can still take our medicines. What are the causes of this mouth ulcer? First of all, smoking can cause mouth ulcer, stress or anxiety, syphilis infection, oral candidiasis. Also, drug reaction can cause this mouth ulcer. Also, genetic factor. There's also deficient feelings. There's also braces, that's poor fitting of these braces, dentures, and other apparatus that may rub against the mouth and gums. Also, it might be caused due to injury from toothbrush. Also, it might be caused due to biting the tongue or inside of the cheek. We have many causes of this mouth ulcer. So, and one thing you need to know is that this mouth ulcer is something that might even lead to mouth cancer. Because sometimes some people just take it as, let's say it's nothing, okay, there are just sores and all that. No, sometimes this mouth ulcer is as a result of an underlying issue, which could also be mouth cancer. So you just have to be very, very careful and cautious of every part of your body. No matter what you see, you just have to try as much as possible to tackle it right from an early stage. What are the preventive measures? There are ways in which you can prevent this mouth ulcer, although to some extent these are just like some tips in case you feel, or maybe you've ever had this mouth ulcer, or for the fact that yes, you are hearing it for the first time. Okay, let me take, because in most cases it has been talked about that this mouth ulcer doesn't have like, you, there's no way you can prevent it, but at least this prevention, these tips will help, will go a long way. First of all, talking to a doctor about changing your medication that are known to cause that are known to cause ulcers, that's this mouth ulcers. Okay, and again, one thing you need to do is that you need to avoid food that can either trigger or worsen the symptoms. Maybe you've had it before, so try as much as possible to know any type of food that might trigger this mouth ulcer for it to reoccur again, because you wouldn't want that. Also, you should try as much as possible to keep the mouth clean with daily brushing and flossing. Try as much as possible to brush. If you can't brush morning, night, please try as much as possible to brush your teeth. Also, if you can't do that twice a day before going to bed, try as much as possible to do this flossing. Okay, also avoid triggers known to cause outbreaks in the past. Maybe you've had it in the past, so I'm pretty sure you must know one or two things that triggers this mouth ulcer from happening or reoccurring again. So I'm going to stop here for today. For more information, as always, you can contact us on the following number: 070-300-99277 or 080-6367-6662. Or you can visit us at our head office, which is at number C21 Safia House along Zaria Road and opposite this bridge called Garden Dengi. And you can come to, if you're kind of like confused about the place, if you know this popular store called Jifatu Supermarket, we are beside this Jifatu Supermarket that is opposite Garden Dengi. Thank you all for listening. Till we meet next time.